In 2008, Lori Kafari was diagnosed with a rare and aggressive form of thyroid cancer.
Hearing the word cancer makes you stop in your tracks for sure. But I was surprised and scared and shocked and all of those things. In the back of my head, I'm thinking, well, how am I going to get through this? What am I going to do to get through this?
When the cancer spread to her lungs, Lori turned to a clinical trial of an investigational therapy that has kept her disease in check.
If we want to make true advances in cancer, let's fund basic research, because that's where everything emanates, the knowledge, the ideas, the understanding.
The new National Survey on Cancer from the American Association for Cancer Research found that 74% of registered voters favor increasing federal funding for cancer research. And 85% recognize that progress is being made against cancer.
Today, with this concept of cancer science, the transmission of the information that we obtain from very basic research to patients is incredibly short. Some of the discoveries that we make within months are already benefiting patients.
I started that on the clinical trial, and then 4 months later it was approved by the FDA, and I'm still taking it today.
We have made spectacular progress against cancer, which has saved the lives of millions of individuals in the United States and around the world. However, without increased federal funding for cancer research, we will not be able to realize the promise of recent discoveries and technological advances. Our national survey shows that this issue is a priority for most American voters, and the American Association for Cancer Research is committed to advocating for increased federal funding for the life-saving research that brings hope to cancer patients everywhere.
The survey was released in conjunction with the AACR Cancer Progress Report 2015, which highlights how federally funded research powers progress against cancer. The U.S. 5-year cancer survival rate increased from 49% in the mid-1970s to 68%, according to the latest research. Since August 2014, the FDA has approved 9 new anti-cancer therapies, 1 new cancer prevention vaccine, and a new cancer screening test. 4 of the 9 approved treatments are immunotherapies, new types of treatment that harness the body's immune system to fight cancer.
The AACR 2015 Cancer Progress Report urges Congress and the administration to implement a strategy for providing annual budget increases of at least 7% for the National Institutes of Health, the National Cancer Institute, and the U.S. Food and Drug Administration in fiscal year 2016 and thereafter.
Innovation always, at the end of the day, brings down cost in any of the areas that you do. So the argument to increase research dollars is compelling at many multiple levels.
You need to do something to help advance research. And if we don't, they're not going to learn. I'm doing everything I can to pay it forward. If I had been diagnosed 10 years ago, I probably wouldn't be here.